Everyone. So I'll go ahead and share my screen and we'll get started here. So I am a board-certified nurse informaticist. My clinical experience has primarily been in the emergency department, but I've worked as an informaticist in the hospital and vendor side of things. So as Gara said, I'm passionate about tech that empowers nurses, not hinder their workflow. And then currently I'm a customer success manager here at Dossier, who's sponsoring this webinar. So um, I wanted to just share a little story before we get started about how I ended up in this role. I was working in the ER as a nurse. I was feeling the strain that many of us do in healthcare, and that was only exacerbated by the COVID pandemic. I started taking some computer science classes on the side, thinking I wanted to find a new career path potentially. Around the same time, I shadowed a legal nurse, which I was also interested in, and that gave me a whole new perspective on the massive amount of documentation that's generated in healthcare. And during that same time, I was involved, and I say involved, but it's more of the voluntold by your leader, where I had to participate in a process improvement project looking at our blood culture contamination rates and the documentation associated with that. So what seemed like three separate, unrelated experiences revealed a path for me that really combined my strengths in clinical practice, my love for technology and problem solving into one. So informatics became that bridge for me. So instead of in caring for just the handful of patients I had in the emergency room that day, I was able to amplify the work I did and implement tools and design tools and workflows that impacted thousands of patients. It was like I was taking the skills I had at the bedside and amplifying the impact far beyond the four walls of my unit and empowering others to do the same. So I'm curious if you guys could throw in the chat, have you heard of nursing informatics before? Does your hospital or organization have an informatics department? Or were you like me and just had no idea and stumbled across it by accident? So our agenda for today will begin by looking at what nursing informatics is, what it's not, clear up common misconceptions. We'll discuss why it matters, how it benefits patients, improves compliance, and drives data-driven decision-making. From there, I'll share real-world examples of how informatics looks in practice. And then finally, we'll review the impact, the measurable outcomes and improvements that result when organizations fully adopt informatics. So we'll start with what is nursing informatics. So the American Nurses Association's definition is the integration of nursing science, computer science, and information science to manage and communicate data, information, knowledge, and wisdom in nursing practice. I know that that is a lot of words. To me, that confused me at first. So in everyday terms, that means that nursing informatics is how nurses use technology, data, and workflows to make patient care safer and easier while helping organizations improve efficiency and maximize their revenue where they can continue to serve the patients. The role of the informatics nurse can vary widely between healthcare settings. So similar to a typical bedside nurse, you can have your workflows vary by specialty, and informatics is no different. So overall, though, at its core, it's grounded in system design, implementation, education, research, and quality improvement. When we have nurses with informatics expertise at the table, they bridge the gap between clinical and technical teams, translating what technology really needs to support patient care. And nurse informaticists understand the need for practical solutions and can communicate those needs in a way that resonates with both our technical teams and clinicians. All right, before we dive deeper into what nursing informatics looks like in practice, I wanted to clear up a few common misconceptions. These myths can hold people back from getting involved and seeing informatics' true value. And I'll be honest, I fell into some of these myths as well until I ended up getting my master's in nursing education. So the first myth is it's just IT or tech support. So nursing informatics is actually a clinical discipline that uses data to drive better care. So while resetting passwords and fixing malfunctioning hardware like a broken mouse or keyboard is important and part of the picture, nursing informatics goes beyond troubleshooting technical issues. It's about using data to identify patient trends, quality metrics, and even competency tracking to identify opportunities for improvement in care. So an example of this is informatics can identify a trend in medication errors early, allowing us to address the root cause before it becomes a safety event or the patient sees that harm. Or in competency management tools like Dossier, organizations can flag those skill gaps across different units and help get staff members the education or competency training they need for things that are maybe high-risk procedures that don't come around as often. The second myth is it's only for leadership or informatics specialists. Nursing informatics empowers nurses at every level, every role, and in every setting, and strengthens the entire organization as a whole. When While fully adopting informatics across the organization has the greatest impact, every nurse can benefit from using informatics tools in their own role. So, like I said before, when I first provided my introduction story, I was a little intimidated. I ended up getting involved in informatics work just because I was told to. I didn't think I belonged at the table, but in reality, there's a place for everybody within informatics. So, like we talked about, these tools can identify patient care gaps, streamline documentation, and provide real-time insights for decision making. In my current role, I work with clinicians and leaders every day who analyze competency trends to identify skill gaps and work with educators to design targeted training that supports safe staffing and regulatory readiness. So when nurses at all levels across all departments apply informatics skills, whether it's something like interpreting data, improving workflows, or acting as a super user like I did with the blood culture project, the benefits are seen by the entire organization. Better patient outcomes, more efficient operations, and a stronger financial performance. Okay, and myth 3, you need to be a tech expert to understand it. The reality is that nursing informatics is built on clinical knowledge. You don't need to know how to code, configure servers, or have an engineering degree. The most important skill is understanding patient care and the workflows surrounding them, because that's what guides how the systems we use are designed, guides how systems are designed and used. So a simple example of this is when a nurse informaticist suggests, or a super user suggests, to reduce the number of clicks when documenting. This kind of insight makes technology work better for everyone. If your organization has an upcoming technology rollout or optimization project, I urge you to consider getting involved. Your clinical expertise is exactly what we need to make sure these systems work in the real world for us. Myth 4, nursing informatics doesn't impact the bottom line. And this myth came up more once I got into informatics. Like I said, not everyone knows what informatics is, and it can be newer to organizations. So some people don't see that nursing informatics is revenue generating, meaning that we can't bill for our services in the same way physicians bill patients or insurance companies. But the reality is, nursing informatics plays a huge role in safeguarding revenue and strengthening operations. So it reduces risk by improving compliance, preventing costly mistakes, and optimizing workforce performance by streamlining documentation, ensuring accreditation readiness with accurate and accessible data. And we can also maximize reimbursement by preventing hospital-acquired illnesses and complications. So when you add up avoiding penalties, saving the staff time, and improving quality measures, these efficiencies translate into measurable cost avoidance and stronger operational outcomes. That's why even if you don't think about the financial side of healthcare every day, the work you do in informatics has a direct line to keeping your organization sustainable and able to keep serving patients. I'll stop there. Do we have any questions so far about what nursing informatics is, some common myths you have heard?
Nicole, we do have a comment from Christine who says she's also an NIBC and stumbled into informatics similarly to the way you did.
Yes, I love hearing that. It's funny how life has a funny way of working out. You just stumble into opportunities that lead you down to exactly where you're supposed to be. And I also want to highlight too that even if you don't have the, I don't know, the want to go fully into informatics and make this your specialty, you can still get involved, and your opinions and thoughts still help with informatics and making sure the tools we have provide a safe, effective workflow without providing additional burden to the nurse. Okay. So we'll go
We
on
do
into
have
why.
a,
Mhm.
sorry, Nicole, we do have one comment that says there's a myth that nurse info do not make comparable salary to clinic nurses, that
Yeah,
nurse informatics don't.
yes, I think that is true. When I first started, I was told that you can make more money as a bedside nurse. And of course, we do what we do because patients are our top priority. But at the end of the day, we also have to look out for our own families and our incomes and make sure the lives we live are sustainable from a financial standpoint as well. That is definitely a myth. I think there is a lot of opportunity for growth within informatics in different roles. So when I first started in my informatics journey, I started on the hospital side. I implemented internal software systems, helped with workflow or flow sheet documentation in our electronic health record. And then I moved into a more specialized area where I am now, where I totally focus on competency content within nursing, pharmacy, and lab. So, and beyond that, I focused on the implementation side, but there's also a whole other side of informatics where you can do analytics as well and work with AI and predictive analytics as a good call out. Yeah, you're welcome. All right, and so we'll hop into why it matters. So we've covered that nursing informatics isn't just about technology, and that brings us to the bigger picture of why nursing informatics should matter to every nurse, every patient, and every organization. Informatics ensures clinicians have quick access to accurate, complete patient information. This allows for earlier intervention and more coordinated care, ultimately leading to safer care and improved health outcomes for the patients. And when these systems are designed well, they help nurses to optimize workflows, cut out redundant documentation, unnecessary clicking, and manual processes. This frees us up to spend more time with patients, reducing the frustration from the nurse's side and the patient side, and supports retention by making the clinician's work more manageable and meaningful. Informatics also plays a critical role in strengthening compliance with standards from organizations like the DNV, the Joint Commission, and CMS. Standardized documentation, built-in checks, and easy reporting keeps teams survey ready and aligned with regulatory requirements. It reduces risk by preventing errors, ensuring information is accurate, and these same improvements also boost operational efficiency by saving resources. And then finally, informatics enables data-driven decision-making. With access to real-time analytics, leaders and frontline staff can identify trends, anticipate needs of staff and patients, and take proactive steps to improve patient care and organizational performance. Informatics in action, addressing common challenges. So when we look at informatics, it's not just about theory, it's truly about solving real-world problems that we face every single day. We've seen how nursing informatics can improve clinical quality, safety, and efficiency. And while patient-centered care will always be our top priority, leaders also have to consider how these improvements translate into measurable value for the organization. So how can we showcase that value, whether you're an informaticist, a bedside nurse, or a leader at your organization? You can do this by focusing on outcomes and the financial health that informatics brings. Safer cares, fewer errors, and stronger compliance just doesn't raise quality metrics, but they protect the organization and patients from costly adverse events, regulatory penalties, and waste of resources. As reimbursement has shifted from fee-for-service to value-based care, informatics empowers hospitals to maximize reimbursement by ensuring the right data, documentation, and workflows are in place. That's where the return on investment comes in. We know that nursing time is expensive, and informatics reduces those inefficiencies, supports staff productivity, and minimizes turnover costs, all of those being measurable returns. A good example of this I found in a literature review by Bartos, where they reviewed a hospital who partnered with a nursing informatics team and an infusion pump manufacturer to integrate smart pump data into the EHR, electronic health record. They achieved a 27% reduction in fluid overrides, 39% increase in charges over a month, resulting in $17,000 saved in net revenue. And this was a fairly small hospital. I think it was 150 beds as well. So if we think what that can mean for large organizations, um, that is a lot of money saved. And then also with reducing the amount of overrides, when we think about overrides, while a lot of times they are justified, and I know personally I have done them as a nurse, we know those extra steps can lead to medication errors. So the integration improved efficiency by reducing pump programming time by up to 77%. So that is an example of a well-targeted initiative that delivered measurable safety, financial, and workflow benefits. But not every project hits that level of impact. I don't know about you guys, but I have all been a part of an initiative or an organization where there's one initiative after another. Each one's well-intended, but some may have more potential value than others. And the people involved in these projects often have limited time and resources. This is where nursing informatics can play a critical role. So consider an organization aiming to improve their emergency department throughput. Initially, this project was handled by non-clinical analysts who reviewed the last order entered prior to discharge. They assumed the completion or lack of completion of this order was the cause for delay in admission or discharge from the ED. However, when orders were completed, the data didn't show any improvement. Throughput didn't improve. So this is where nursing informatics who brings clinical context and deeper understanding of workflows can make a difference. In this particular case, after they realized the throughput didn't improve, they looped in an informatics team to do a review where they revealed there wasn't an issue with throughput with this specific order at all, but a documentation gap. The last order in question wasn't being marked as completed in the system, but in fact, the analysis revealed the nurses were completing the vital signs, and the delay resulted from orders placed much earlier during their stay. Things like resource availability of CT machines or medications. So this process provided the organization actionable data to triage process improvement projects that gave the highest yield. So instead of focusing on the discharge vital signs at the very end, they started to focus on maybe they need another CT machine, or how can they improve throughput through the CT machines, or how can we improve access to medications for the nurses in the ED? Any questions about that? Let us know in the chat if you've ever been a part of a process improvement project that you feel like didn't pan out, and what you would suggest to improve the process. All right, regulatory and accreditation support. So regulatory bodies like the DNV, the Joint Commission, and CMS set standards we must meet to ensure safe, high-quality care. We all know what it's like to scramble before a survey, but the key to success here is building readiness into your everyday practice. Informatics makes these requirements part of your daily workflow. So compliance happens automatically, and it's not an afterthought where you're scrambling. So for example, instead of tracking hundreds of competencies manually or quality measures, informatics tools can pull data in real time from the EHR, lab systems, or documentation workflows, can automatically flag decision points critical for patient outcomes, or it can provide dashboards that show leaders exactly where the organization stands at any moment. So what this means is less administrative burden, clinicians spending less time preparing for audits and more time providing care. And because that data is live and accessible, leaders can identify areas for improvement before they ever become adverse events, citations, or fines. An example of how data and analytics can drive proactive intervention is a sepsis alert system. So sepsis alert systems often monitor patient vital signs and lab results when certain thresholds are met based on evidence-based guidelines. The system triggers a warning to the care team. This gives the care team a prompt to intervene earlier to prevent patient deterioration. In other words, this gives clinicians access to timely and relevant information that has a direct impact on patient care. So it's a highly valuable tool that empowers clinical judgment, not replace it.
Hey,
Workforce.
Nicole,
Mhm.
I do
Yeah,
have two questions. So
yeah.
the first question is, are there specific technologies that you are excited about for the future of nurse informatics?
Yes, I'm sure this is an obvious one, but AI and clinical support tools or decision tools. So an example of that would be the sepsis tool, where it's constantly monitoring certain data points or information in the background and can automatically provide a prompt for you to be proactive. So a lot of us know what the signs of sepsis are: high fever, high heart rate, um, certain high lab values. But a lot of times we don't have time to be constantly digging through the chart and assessing for this. Tools, informatics tools allows us not to have to do that. It puts that information face up where we can act on it, saving us time. And then I think specifically for AI, it will amplify what nurse informaticists and healthcare organizations already do. We already see the benefits in expanding access to medical care through AI virtual nurse programs, improved accuracy and management of documentation. And so, like I said, for nurses, this means earlier detection of patient deterioration, documentation that happens automatically in the background, and care plans that are truly tailored to that patient, all integrated into your daily workflow. However, I think it's equally important to acknowledge the challenges with AI. So all systems are influenced by all AI systems are influenced by bias in their algorithms or the information we give them to train on. So inaccurate data or biased data can lead to errors in recommendations and decision support, further amplifying some of the health disparities we already see. So ultimately, to prevent that, we need to strengthen the partnership between AI, nursing informatics, and healthcare providers. Thank you. Are you
The
guys
second
excited? Mhm.
the second question, it looks like you're about to answer it here, but it says, how has nursing informatics provided more flexible career opportunities?
Yes. So I never thought I would be able to have such a large impact on thousands, hundreds of thousands of patients. So when I was a bedside nurse, all I focused on was my 4 patients at the time in that shift. Now with Dossier's help, I help organizations all over the world, hundreds and thousands of people at some of the leading hospitals, uh, provide competency management systems to make sure their staff are competent to provide care and allow leaders to organize people in a department that's best aligned with their skills. So I think of how helpful this would have been for my organization when I was working in the emergency department during COVID. We often had nurses from other units come down and help, but they didn't know anything about the emergency department or critical care practice. But if we had something like Dossier, we could see what skill sets or certifications people had and allocate them to the appropriate department.
We have someone asking if Dossier offers a nurse informatics boot camp or prep.
At this time, we don't, but that would be a great topic for a future webinar series. I'm kind of jumping ahead here, but we haven't totally solidified the next few webinar series. So if that's something you're interested in, I'm sure we could look at offering something like that in a webinar series. And what we were talking about ties directly into workforce development. So understanding informatics allows us to understand our workforce on a deeper level. With analysis, we can spot trends in performance, engagement, and even turnover. This kind of visibility allows leaders to take a proactive approach. So when we address these issues early, we can create an environment where staff feel more engaged, satisfied, and supported. That directly improves retention and builds teams that can adapt to new challenges with confidence. So and hopefully we won't have another pandemic, but as you know, healthcare is always changing and presenting itself with new challenges. So we can know with confidence that our teams feel supported and are able to manage those changes. And then from the work I do with Dossier, we can quickly see which departments are consistently meeting standards and which departments may be slipping with their engagement. And that could signify that turnover risk is high. So that insight makes it possible so the educators and leaders can step in early to address a bottleneck, offer targeted training, or provide extra support. So we have another question. What
We do.
classes, study
Sorry.
material, or I actually was able to see this one. What classes, study material, or boot camps, if any, did you complete outside of your master's degree to get board certified? So at the end of this presentation, there are several links or references in the American Nurses Association. The American Nurses Informatics Association has a lot of resources on preparing for your board certification and getting involved. And I recommend you subscribe to their journal as well. Right, and that brings us to our close. So that's the real power of nursing informatics. It's about turning insight into action. Oftentimes I think that it's often thought about as just dashboards and data points, but it's about giving clinicians the workflows and tools they need to care for the patients to care for patients effectively and efficiently. When we do that, we're not only improving care, but protecting and maximizing reimbursement and revenue by reducing waste, avoiding penalties, and keeping resources focused where they matter the most.